Let me, is it Folk?
Yes, thank you.
Good to see you. Let me ask you, with regard to the budget request, the $5 million, which, as I understand, is about a 1% increase over FY 2007 to ensure that the 111 million Americans benefit from safety and health conditions in public and private workplaces. The expansion of OSHA's voluntary program, although it's my understanding, is financed by terminating the $10 million Susan Harwood Training Program, which focuses on the prevention of workplace hazards. Since 2001, OSHA staffing will have dropped by 192 positions, or 8.1%, from 2,370 to 2,178 in 2008. Let me ask you, in terms of just the reduction of positions as well as the level of safety, when you slash the funding for the Susan Harwood Training Program, I mean, we all know that an ounce of prevention is worth a pound of cure. And so could you give me some rationale for that and why that's done?
Yes, I appreciate you asking that question because with respect to the Susan Harwood grants, these are very, as a general, limited type of training programs, limited in area, limited in scope. And OSHA has developed a whole series of training programs outside of the Susan Harwood grants, which the agency believes does cover a much broader range. We have our OSHA Training Institute outside of Chicago, which does a lot of provides training on all types of safety and health topics. Part of that also we have our education centers, and most of these are located in either colleges or universities or community colleges throughout the country. We have, I think, 19 or 20 education centers, which last year I believe trained over 1 million employees. So we have these other options that other training opportunities that have a much broader scope, have a much more broader impact on training. The money that we're using, part of the money, yes, from the reduction in the Susan Harwood grants, is going to extend our compliance cooperative programs, basically the VPP programs. Once again, the idea being, as you mentioned, about prevention. We're attempting the VPP programs, and you look at our whole array of compliance assistance programs, but particularly the VPP program, they allow us to prevent injuries from occurring. We're actually encouraging employers to have comprehensive safety and health programs in their individual facilities so that they will prevent injuries, illnesses, and fatalities. And I know you agree with me that we can prevent someone from being injured, and Lord knows that we can prevent somebody from being killed. That's well money spent, and so that's kind of where our focus is.
But are you saying that the Susan Harwood Training Program was ineffective? Are you saying that this program now, the components of it will be secure, but in other areas? Are you eliminating it? Why are you doing it?
The training itself, I mean, we're still going to be doing the outreach in our training programs from the Susan. What is done in Susan Harwood, once again, these are very focused, limited area training opportunities, and we're trying to expand them. We use our training opportunities that we have. We just felt like that we could utilize the money from the Susan Harwood grants because we are doing the safety and health training in other areas. We could use that money to where we need to have our resources more effective, and part of that effectiveness is focusing in on our compliance assistance.
But in the limited training of the Susan Harwood Training Program, what happens to that limited training, those program components? Is it just wiped out? Are they going to be initiated or implemented in some of these other programs, or are you?
Yeah, well, the training that we do, and you know, the topics, what we do on Susan Harwood, we each year try to determine specific topics that we're going to be focusing on. One of the areas last year was I'm trying to think. We had one was dealing with construction, residential construction, falls, and so we have a lot of training that we're already doing in those areas through our OSHA Training Institute and the ed centers. And so once again, we just feel like this was a better utilizing our resources where we needed to put it, where we thought we could do more with prevention and helping eliminate or prevent injuries in that.
Madam Chair, may I ask, Mr. Falk, would you please let us know or submit sort of a plan on how this, what will be reduced, the types of programs under Susan Harwood, and how you, and where you intend to make sure that we're covered in other?
Well, the programs
Programs.
will be, I mean, what we're trying to do is, we are eliminating the money for the Susan Harwood grants in the 08 budget, and allocating that to other programs, which will go for prevention. I'm just saying that we do have already a fairly detailed training program already in OSHA through its training institute, and it's also through its ed centers, that I think accomplishes the mission that we're.
But could you just
Yeah,
let us
that's
see
fine.
that?
Yes,
Thank you very
much.
much.